video, I'm going to go over systemic lupus erythematous, and we call this lupus for short, or we abbreviate it SLE. So let's talk about the pathology involved. For some reason, the body attacks the connective tissue, and I don't really know the reason for it, but it's an autoimmune disorder. That means the body sees itself as foreign. So in this case, in all the connective tissue diseases, the body attacks the bones, the joints, the tendons, elastin, which helps your skin have elasticity, and membranes that surround organs. Now, most connective tissue disorders have the same signs and symptoms, but there's usually a couple defining characteristics. So let's go over to the signs and symptoms, and you can use the mnemonic MD SOAP brain. Okay, the defining characteristic in lupus is they have a malar rash, which malar means cheek, so they have a butterfly rash on their face. Okay, that happens in lupus. D stands for discoid rash. There is two versions of lupus. One is systemic, meaning it attacks the whole body, and the other one is discoid, which only attacks the skin. Now, people with systemic lupus are going to have skin rashes, but people with the discoid version will only have rashes on their skin. Serositis. This is the serous membranes are the outside linings of like the heart and lungs. Okay, so they could have inflammation on those organs, and you'll see that's true for most connective tissue disorders. They could have oral ulcers and nasal ulcers. Many people with connective tissue disorders have arthritis, anemia, and lupus also has alopecia. Now, with lupus, they're going to develop photosensitivity, which means they shouldn't go in the sun. Being in the sun, getting like a tan or a sunburn could really exacerbate, okay? So they could have a flare-up of their lupus just by going in the sun, okay? There's blood cell destruction, so they're going to suffer from pancytopenia. Now, we talked about pancytopenia when we talked about chemotherapy and radiotherapy in cancer. So remember, thrombocytopenia, neutropenia is going to put them at risk for infections, and anemia is going to put them at risk for fatigue, and so that could develop into chronic fatigue. Okay, there's be renal involvement, so people with lupus are at risk for renal failure. The ANA, which stands for anti-nuclear antibody, is going to be elevated, or I should say present, and the erythrocyte sedimation rate will also be elevated, and the C-reactive protein also elevated. So those are labs, and they're kind of nondescript for inflammatory disorders. In other words, you're going to see these labs elevated in other connective tissue disease and in other conditions where there's inflammation. But it does tell you there's some kind of inflammation in the body, okay? It's an immunological defect, right? It causes it's an autoimmune disorder. And neurological manifestations, they could have like numbness and tinglings in their extremities. They could have like headaches. They could be apathetic at times. So there are a lot of signs and symptoms that happen with lupus. Now, the complications are from, for example, the serositis I talked about when I talked about the lining of the heart and lungs. So they could develop pericarditis, which is inflammation of the lining around the heart, or pleuritis, which is inflammation of the lining of the lungs. And what you would hear is a friction rub in either of those places. And also, the patient is going to complain that it hurts when they breathe in. Okay, so that's an important thing. They could develop a very high fever. People with lupus could have low-grade fevers when they're have an exacerbation. If they are going to have a big flare-up, they could get a higher fever, and of course, they're at risk for infection. They'll have swollen joints. They'll probably be warm and red, and arthritis is a feature in most connective tissue disorders. I talked about renal failure. That is a complication from lupus, and then Raynaud's phenomenon. Now, Raynaud's phenomenon, that occurs, it's due to arteriolar um, vasospasm, and this can happen in most connective tissue diseases. It can also happen for no reason in young women like age 30, okay? Now, it's triggered by cold and stress, okay? And we'll talk this, we'll hold on, we're going to talk about that a little bit more. Now, the risk factors for lupus include women 15 to 40 years of age. Asian, Black, and Hispanic women have a higher risk. If you have prolonged sun exposure, so people who have prolonged sun exposure, that could cause a flare up, and noncompliance with medications, which could cause a flare up. So, one of your jobs as a nurse is going to be to teach patients the importance of medication compliance, not only in lupus, but all these disorders we're talking about, um, connective tissue disorders and disorders that affect the joints. Okay, so the nursing care, you're going to monitor for pain and medicate PRN, encourage periods of rest and activity because of the anemia, right? That's part of the pancytopenia. But also, you know, the autoimmune disorder wreaks havoc on the body, and they're going to be at risk for chronic fatigue syndrome. Monitor for renal failure. So, what you'll see is edema. They'll have hypertension, a low urine output, and a high BUN and creatinine. I talked about med compliance, super important, and they need to take their temperature daily. Okay. Medications are NSAIDs, which you know can cause bleeding ulcers. They shouldn't take them on an empty stomach. Corticosteroids, which you know can increase the glucose level, so they could have hyperglycemia, hypertension, ulcers. There's a whole bunch of stuff that can happen, a whole bunch of symptoms that can happen when somebody's on corticosteroid therapy. Antimalarials, they could be taking that as part of their medication regime, and they would need to have frequent eye exams. For Raynaud's teaching, now I don't think I mentioned this, but in Raynaud's phenomenon, it's usually on like one side of their hand if it's due to a connective tissue disorder, but it could be both sides too. It could be like both hands. So what happens is in when they're stressed with cold weather, or say they go in to the freezer and try to bring something frozen out, that could trigger it too. Okay, so what happens with the hand is it will turn white, then it will turn blue, and then it will turn red as when the spasm is over. Okay, so white, blue, and red. And it can be very painful for them when that is happening. Okay, so you're going to teach them to wear multiple layers of clothes in the cold weather. Don't smoke. Um, Walk several times a day to promote circulation. No nicotine products too. Every time I say no smoking, that means nicotine too, because nicotine vasoconstricts. They should not elevate the extremities while they're having an attack, and they need to avoid triggers and manage stress. So that's super important. Other teaching is that you want to tell patients with lupus to minimize their sun exposure because of that photosensitivity. Wear wide brims hat, long sleeves, and pants. Sunscreen has to be 30 SPF. Okay, that's very important for anybody at risk for some problems for being in the sun. Report edema. You got to teach them that, and flu-like symptoms. Flu-like symptoms like joint pain, muscle pain, fever, that could indicate that they're about to have a flare-up, an exacerbation of their lupus. Avoid harsh hair treatments because alopecia, which is baldness, is a sign of lupus. Apply lotion to the skin twice a day and pat it dry. Don't like rub the skin because the skin can get damaged. And stay away from crowds. People that have autoimmune diseases are going to be on medications that reduce their immunity, and they are going to be at high risk for infection. So you want to always tell them to stay away from crowds. All right, that's your disease sheet for lupus.